Hello, my name is Eirini Zartaloudi and I'm a PhD student in the Division of Psychiatry, University College London. I am presenting one of the projects from my PhD thesis investigating influences of polygenic risk scores and copy number variations on the risk of developing psychosis. Psychotic disorders, including schizophrenia and bipolar disorder, have a lifetime prevalence of over 3%. The etiology of psychotic disorders is attributed to an assortment of factors, including both environmental and genetic influences. Over 145 single nucleotide polymorphisms have been associated with schizophrenia and 30 with bipolar disorder. Individually, their predictive power is exceedingly small, and the calculation of a cumulative polygenic risk score has been suggested as a better alternative to estimate the disease risk. Several copy number variants have also been associated with increased risk of developing psychosis. Despite the wealth of evidence for both single nucleotide polymorphisms and copy number variations contributing to the genetic liability for psychosis, their joint effect on the liability for bipolar disorder and for psychosis broadly defined has not been studied yet. To our knowledge, this is the first study exploring their joint contributions on psychosis risk. The study was performed using two independent samples, the Molecular Psychiatry Laboratory or MPL dataset from UCL and the Psychosis and Phenotypes International Consortium Family Study, PIKE dataset. Both datasets had cases with psychosis and healthy controls, and genotyping was performed in Illumina for the MPL dataset and in Affymetrix for the PIKE dataset. And this was the reason why we could not just simply combine the two datasets, and we had to analyze them separately and then perform a meta-analysis. Polygenic risk scores were calculated for both schizophrenia and bipolar disorder with the PRECISE software using the data from the latest Psychiatric Genomic Consortium. For our statistical analysis, we used logistic mixed effects models with the clinical status as the outcome and the schizophrenia and bipolar polygenic risk scores and CNV burden as measured by the number of genes affected by deletions as the predictors. We also used gender, age, three principal components to account for population structure and a kinship matrix to account for relatedness between individuals as covariates. The proportion of variance explained by the genetic liability measures was calculated as Nagel-Kerkis pseudo R-square through the comparison of the full regression model with a reduced model that included only the covariates. Then we calculated the area under the receiver operator characteristics curve in all our models, and we finally performed a prognostic accuracy meta-analysis of the areas under the ROC curve. When analyzing both datasets separately, the predictive accuracy for all our models varied from fair to good, and in the meta-analysis, the classification accuracy of our model was 81% for the comparison of all cases versus controls, 77% of all bipolar cases versus controls, and 83% of schizophrenia patients versus controls. On the right side of the poster, you can also see the plots demonstrating the ROC curves for both datasets, the MPL dataset in the left and the PIKE dataset in the right. The x-axis shows the false positive rate and the y-axis shows the true positive rate. So as you can see, the more the positive rate increases, the more the false one decreases. In conclusion, a better understanding of polygenic risk scores and CNV influences on the risk of developing psychosis is crucial for developing new biologically informed treatments. In our study, we provide evidence that both polygenic risk scores and CNV burden are powerful research tools, albeit not yet accurate enough for clinical use. Thank you very much for your attention.